This week, Federal Minister of Health and Member of Parliament for Thunder Bay Superior North, Patty Hajdu, called the Lakehead a COVID hotspot. Here to give us an update on that and on a new crisis intervention initiative underway there in Red Rock on the north shore of Lake Superior, Charnel Anderson, who covers the northwestern part of the province for Ontario Hubs. Welcome to the show.
Thanks, Jan.
So earlier on, Thunder Bay had done a pretty decent job in controlling the virus. What happened?
Yeah, well, here in the Northwest, it's a pretty beautiful, relatively isolated location. And so for much of 2020, our COVID-19 cases were relatively low. But that changed in the fall. There was an outbreak among some pickleball players, and then there was an outbreak in Southbridge Roseview, a long-term care home. Unfortunately, that resulted in the death of about 23 residents there. But still, it was mainly institutional outbreaks at this point that were driving the numbers. And that remained true through January with the announcement of two outbreaks in two correctional facilities in the city. So those were declared on January 6th, and by the time they resolved, they infected nearly 200 inmates and correctional staff. I also understand there were at least 4 inmates released while positive for COVID-19. And so about a month after the jail outbreak was announced, the Thunder Bay District Health Unit announced an outbreak among the vulnerably housed population, so people who are experiencing homelessness or vulnerably housed. And so that was in February. Not long after that, the numbers started rising kind of throughout the community. And so that rise has been reflected in the number of people in hospital with COVID-19. So as of yesterday, there were 39 people from the Thunder Bay region in the hospital receiving COVID-19 treatment for COVID-19. And 12 of those were in the intensive care unit. As well, there was an outbreak declared in the hospital last week in its 1A medicine unit. So that prompted the hospital to go into lockdown. And then the following day, they started sending intensive care patients to other hospitals in southern and eastern Ontario.
Now, I'm sure this is not a title that Thunder Bay wants. Currently, Thunder Bay region has the most COVID-19 cases per capita in the entire province. There are some other contributing factors in how this virus is spreading. Can you share what experts have been telling you?
So I spoke to Dr. Janet Mill, who's the medical officer of health at the Thunder Bay District Health Unit, and she had actually published a video on March 8th, so about 2 weeks ago, saying that COVID-19 is essentially everywhere. And so up until this point now, the outbreaks in the correctional facilities have been resolved. Meanwhile, the outbreak in the vulnerable population remains ongoing. But, Dr. DeMille emphasized that there are a number of factors contributing to the spread. She's heard anecdotally about people gathering together, children's birthday parties, just more people interacting. And of course, that's how this virus spreads, right? As well, there's been a variant of concern identified in the region. We don't know exactly what it is yet, but we do know that it's here now.
Now, under the province's COVID-19 response framework, Thunder Bay region right now is in the gray zone, which means lockdown. What are we hearing from in terms of government response and the public health units? What are they doing?
Right. So, a number of politicians, as well as Dr. Janet DeMille, they want the province to declare Thunder Bay a COVID-19 hotspot. So, for example, that would have allowed possibly Thunder Bay to participate in the AstraZeneca pilot project that we're seeing in places like Toronto, where the pharmacies are administering the vaccines. So that is not happening in Thunder Bay right now. However, we have received, I believe, 1,000 additional doses of the Moderna vaccine this week, and so that is above and beyond what we would have received otherwise. And in terms of other support, the province and NGOs they've provided support in terms of contact tracing as well as human resources for the isolation shelter. And so we're still waiting to hear about federal support. As you said, Patty Hajdu, so she made an announcement the other day. She's from Thunder Bay, right? And she said that they're working on some support for the isolation shelters, and that was a request from the city of Thunder Bay when they declared a state of emergency in early February.
I want to actually move to another kind of crisis. You were working on a story about Thunder Bay's recently launched update to its crisis response unit. Can you tell us about this program?
Yeah, so back in January, the Impact team was launched in Thunder Bay. And so Impact stands for, let me see if I can remember, Integrated Mobile Police Assessment Crisis Team. And so essentially what it is it's teams of two, one police officer and one mental health crisis worker. And what they do, so there you can see Constable Jeff Elvish and Victoria Lane, who is the crisis worker. Um, and so they ride together and they respond to mental health calls together. And there's a photo of the team training. So there are police officers as well as the crisis workers. They did that training in 2020, kind of prior to the launch of the Impact team. And so the Impact team is a partnership between the Thunder Bay Police, the Canadian Mental Health Association, and the Thunder Bay Regional Health Sciences Center. And it actually builds upon a previous initiative, which was called the Joint Mobile Crisis Response. But the difference is now there's kind of more integration between the police and the crisis workers. So they ride together, as I mentioned. And also, this program runs 24 hours a day instead of 12 hours a day as its predecessor was running.
Now, I'm curious, what led to the creation of the team? What was the need?
Yeah, so in Thunder Bay specifically, mental health calls have been on the rise throughout the last 5 or 6 years. So, for example, in 2014, there were just over 1,055 mental health calls made to the Thunder Bay Police, and that rose to about 1,800 in 2020. And so before the launch of these initiatives, police officers were often tied up in the hospital um, waiting for a patient to be admitted. And so it was always two police officers responding to these calls. And so that's two police officers who are waiting in the hospital like 5, 6, 7 hours. And then, maybe another team responds to another mental health call. Then there's four officers waiting in the hospital. So that was a big issue for them. But this is also about connecting people to the right services, because not everyone needs to go to the hospital, right? Maybe there's more appropriate care in the community, and so the Impact team has more knowledge and more resources in terms of being able to connect people to more appropriate service.
Now, this may sound like a dumb question, but I am curious, how did police come to respond to mental health crises in the first place?
Yeah, I mean, I was wondering about that too when I started working on this. And, because a lot of people say that, maybe the police aren't the ones who should be responding to mental health calls, right? Maybe they don't have the resources necessary. So, um, but of course, the world we live in, oftentimes it is the police who are responding to mental health calls. And that kind of goes back to the 1960s. Over these policies, the government started instituting policies of deinstitutionalization, so moving people out of psychiatric care facilities in hopes that they can receive care in the community. And so the government has done a good job of getting people out of the facilities, but a lot of the times the services haven't kept up with the demand, right? So that's why oftentimes we see the police responding to these calls. And so these mobile crisis response teams like Impact have been established as a way to decrease police presence on mental health calls.
Now, we have less than a minute left, and I want to touch on sort of the results. We know this program, it's not the first in the province. There are other police services in Niagara and Hamilton and in Sudbury that are doing it. Do we have an idea of whether this crisis response initiative is actually working?
I mean, yeah. So locally in Thunder Bay, over a 6-week period, they have some statistics, and so they were able to divert 40% of people away from the hospital. So it is working in that sense. And I believe when people do end up in hospital, it's a bit of a quicker process. In general, though, I spoke to an expert who said he studied mobile crisis response teams, and he said they are promising in terms of reducing the police presence, as well as they're associated with decreases in use of force and unnecessary hospital transfers. So I think they are a promising initiative, and that's why you see them all over the province now.
Charnel, I want to thank you so much for bringing a very important story to us tonight. That's Charnel Anderson, our Northwestern Ontario Hub journalist.
Thanks, Jan.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.